With me now is Professor Talia Miron Shatz, the director of the Center for Medical Decision Making at Ono Academic College. Professor, thanks so much for being with me. I just want to ask if I can, I know that you didn't make this decision, but about the idea of the medical decision-making process. I mean, Israel's hospitals are not filling up with COVID patients. They're not pushing the healthcare system to the brink of a collapse. It is literally the opposite. Literally every day, the number of serious cases is going down. So I guess what justifies the new restrictions, the talk of a lockdown, the closures? Is it rational in your mind?
It is, and I have to say it's rational. It's not fun and it's not easy, and none of it is going to be either fun or easy or not involving a compromise anytime soon. I think it's rational in the sense of preventive medicine. We don't want the hospitals to be full. So the government is saying, what can we do? We can encourage people to vaccinate. We can encourage people to vaccinate their children. We're doing very poorly there. People are demanding their rights, the right for schooling, the right for everybody to be schooled, but they're kind of slacking on their obligations, like the obligation to vaccinate. So I think the government is pushing toward that and also protecting weaker populations. And this makes a lot of sense. And I want to say something else. The Israeli government and other governments as well are navigating without a map. There is no map.
Tell me this isn't a government operation.
It's completely new. It's uncharted ground and it changes by the moment. So I think to be on the more cautious side to err on the cautious side is actually very good. We should thank our lucky star. We should thank our lucky star. We should thank our lucky star.
There's so much more meaning to the Star of David than just a Jewish symbol represented on the Israeli flag. The six-pointed star holds mystical and occult secrets that transcend religion, ethnicity, and culture.
We should thank our lucky stars that we're not living in countries that are more complacent.
But Professor, I want to ask, we are not exactly, I don't think, without a map. This isn't a variant of concern that was just discovered yesterday. It's been over a month in Israel. It's been circulating in South Africa for a month and a half now. There are multiple weeks of evidence, and clearly it is not overrunning the hospitals in Israel or in South Africa. Even the UK now, there's a multiple-day drop in the hospitalization rate. It's not putting any healthcare system, I don't believe, anywhere on the brink of collapse. I mean, is there a balance here between being cautious and listening to the actual data?
Of course. So I think the Oymicron, or as people are calling it for some reason, the Oymicron, because it's like oy and it's so terrible. It really is not. And I completely agree with you, Jeff. People are also affected by the Delta variant, and that needs to be taken into account. And we also really need to be careful that it doesn't spread more. Well, we've seen our waves of COVID, yes, but also waves of governments laxing restrictions only to then restrict even harder. So I think that's where the government tries to be now, in a way that will encourage vaccination, mainly. That's the main thing we can do. Whether or not people will rush to get the fourth vaccine, I don't know. For healthcare professionals, I think it's probably a good idea. And the reason why I'm saying without a map is because we really don't know. I mean, in the beginning of the vaccination campaigns, people were super concerned about long-term effects. Who knows what the long-term effects of the fourth vaccination are? Who knows what the long-term effects of the fourth vaccination are? Nobody literally knows. Nobody literally knows. Who knows what the long-term effects of the fourth vaccination are? Nobody literally knows.
Yeah.
So,
Professor, from a medical, ethicist point of view, is it justifiable? Is it reasonable to impose a vaccine mandate? I mean, many parents who we've interviewed here on 924 News have said, before we're talking about vaccinating my 5-year-old kid or a preschooler, make the adults get vaccinated, make them be up to speed on their vaccines before we do kids. But is there a reasonable medical ethical debate about making people get vaccinated? We have over 1 million Israelis either unvaccinated or under-vaccinated. Should we make them do it in order to appear in public spaces?
I think I think that's what's happening now. And I actually think it makes a lot of sense because people are making choices. Some people choose to vaccinate and protect themselves. Others do not. And some people just cannot be vaccinated, like younger children or people who cannot receive the vaccine for medical reasons. So what kind of society do we want to live in? Do we want to live in a society that protects us as much as we can, both health-wise and economics-wise, or in a society that says, you do you, and if you catch COVID and if the whole class goes into quarantine and the smaller children who can't vaccinate get sick, well, tough luck.
Yeah.
How is that fair?